Imagine this. You're having surgery. The anesthesia has paralyzed your body. You can't move, can't speak, can't even open your eyes. But you're awake, fully conscious, feeling everything. This is called anesthesia awareness, and it happened to the man who pioneered modern anesthesia safety protocols. Dr. Henry Beecher was one of the most influential anesthesiologists in American history. At Harvard Medical School, he revolutionized surgery. Before Beecher, anesthesia was dangerous. Patients died on the table. Others woke up mid-surgery, screaming. Beecher developed systematic approaches to monitoring anesthesia depth. He made surgery safer. He understood it better than anyone, which made what happened to him even more terrifying. In the mid-50s, Beecher himself required surgery. As a fellow physician, Beecher felt confident. He knew these doctors. He'd trained some of them. The procedure should have been routine. First, the paralytic. This drug stops all muscle movement. You can't move, can't speak, can't even flutter your eyelids. Then comes the anesthetic, which should make you unconscious. But something went wrong. He was fully awake. Beecher could hear everything, the surgeons talking, instruments clanking, music playing in the background. He tried to signal them, tried to move his hand, his finger, anything. But the paralytic had him completely locked in. Anesthesia awareness is one of the most psychologically traumatic things in medicine. You're completely helpless, and then you feel the pain. When the incision came, Beecher felt it. Every cut, every pull, every suture. Unable to scream, trapped inside his own body. Minutes felt like hours. He knew his colleagues had no idea he was awake. He knew there was nothing he could do but endure it. When Beecher officially woke up, he was shaking, traumatized. He told them what had happened. Many doctors didn't believe patients back then. They thought it was dreams or hallucinations, but Beecher was an expert. He knew exactly what he'd experienced. Beecher became obsessed. He began studying intraoperative awareness systematically, interviewing patients, reviewing cases, looking for patterns. His personal experience gave him unique insight. He knew what to ask patients because he'd lived through it himself. His research led to better monitoring techniques, ways to measure brain activity, methods to detect consciousness when patients couldn't move. Today, every operating room has sophisticated monitoring systems that track anesthesia depth in real time. They trace their origins to him. Anesthesia awareness still happens, about 1 in 19,000 surgeries, but it's far less common now, and we believe patients. Beecher also became a pioneer in medical ethics. His 1966 paper helped establish informed consent. Beecher's nightmare became his mission. He made sure that what happened to him would happen to fewer and fewer patients over time. Every day, millions of people undergo surgery safely, never knowing the horror Henry Beecher endured. They're protected by his trauma. The anesthesia expert who used his worst nightmare to make sure others wouldn't have to live it. He was a protector until the end. Next time on the Patient Zero Paradox, Kay Redfield. Jameson reveals she has the condition she spent her life treating.